Hello, everyone. Thank you for attending today's webinar, Influencing ADC Performance Through Linker Design, presented by Vector Labs. My name is Joan Wiseman, and I will be hosting today's webinar. I'd like to start by introducing today's speakers. Dr. Dowdy Jackson is a consultant from Jackson Consulting Group, and Matthew Giese is the senior scientist at Vector Laboratories. You can read their full bios on the left side of your window by selecting the Speakers tab. Just a few notes before I hand it off and we begin. There are additional resources available with today's presentation. You can click the Handouts tab on the left side of your screen and download them from there. If you would like closed captions, they are available from the bottom right corner of the video player. You can turn them on there. And this webinar is being recorded, so you will be able to watch it on demand within 24 hours after we finish here today. Finally, we would love to hear from you. If you have a question at any point during the presentation, feel free to submit it using the Q&A tab on the left side of your screen. Time permitting, we'll conclude with a Q&A session and answer as many as we can. All right, we're ready to begin. Dr. Jackson, please go ahead.
Great, thank you for the introduction. What I'm going to do, I'm going to start off with this slide in particular. And this is the slide that kind of encompasses everything we're going to talk about in this webinar today, both Matt and I. We're going to talk about the types of linkers that you want to consider for developing your ADC payloads. You're going to talk about the conjugation sites, because the linkers consist of two parts. There's the part of the antibody, and also there's the payload part as well. And we're going to touch a little bit about some of the things you want to consider when you start developing your ADCs in terms of the payload and hydrophobicity, and also what you want to consider with regards to looking at drug-antibody ratios. But to start, we see that there are essentially two different types of linkers. There's cleavable linkers and there's non-cleavable linkers. Within that, we also have linear or branch linkers, and you have combinations of both. And then I know you'll hear more about this during Matt's presentation. On the antibody side, as I mentioned before, we have cysteines, lysines, non-natural amino acids, and carbohydrates that you can use to conjugate your linker payloads to the antibody. Within that whole category, also, you have site-specific ADCs and you have stochastic or random conjugation methodologies. And the random methodologies are primarily conjugated to cysteines or lysines, while the site-specifics can utilize either site-specifically located cysteines, non-natural amino acids, or the carbohydrates that I had mentioned previously. And I'll show specific examples of these different types of methodologies in my part of this presentation, and I'm sure Matt would do the same thing as well. Once we go beyond just conjugating to the antibody and your payload, we really have to take in consideration some of the CMC properties with your ADCs as well. I'm not going to go through every single last point, but one of the key points you'll hear from my part of the presentation and Matt's part of the presentation is related to minimizing aggregation. And this is going to be important because this is why you use different types of linker chemistries to mitigate the polarity of the payloads to minimize aggregation. So take into consideration linker stability and also the pharmacokinetic properties of the ADC to help us maximize the therapeutic index. So in this slide, it's just an overview of what an antibody-drug conjugate is. We know that for antibody-drug conjugates consist of three parts. There's the antibody part, there's the linker, and then there's the cytotoxic drug or payload that's used as well. We know from the antibody side of things, right, there's different types of antibodies that we use as IgG1s, IgG2s, IgG4s. I'm not going to talk about those specifically, but you will see them on some of the slides moving forward. With regards to the linkers, there's different types of linkers, as I mentioned before. There's protease cleavable linkers, there's non-protease cleavable linkers, there's a pH or acid labile linker, glutathione, and sulfatase linkers. All these are cleavable linkers that take in consideration some of the key features of functionalities within the tumor cell that will also elicit the actual release of the payload within the tumor cells themselves. As I mentioned before, also there's linear and there's branch linkers as well, and we'll hear more about. Now, how do ADCs work? We know that ADCs essentially bind to the cell surface antigen on tumor cells in step one. They're internalized, and upon internalization, they make their way from the endosomal compartment to the lysosomal compartment, where they actually are released. Now, in the lysosomal compartment, you have a lot of different features here. You have low pH environment, and you're going to have proteases as well, which facilitate the release of the cleavage of the payload into the intracellular compartment. And depending on the mechanism of action of the payload, will either inhibit DNA synthesis or inhibit tubulin synthesis, which results in the induction of apoptotic cell death in the tumor cell. In addition to this, we know that some of the payload would actually be released. And if the payload is released, some of those payloads will actually go into nearby neighboring cells that don't express the tumor antigen, but were also killed by the payload through an apoptotic cell death. And this phenomenon is known as bystander activity. So as you go through the process of developing your ADCs, and you have to make a determination of whether or not you want bystander activity or not, and that's going to help you with regards to selection of the appropriate linker for your ADC. In this slide, it really highlights why you want to develop an ADC. So there's two specific reasons as to why you want to develop your ADC. One is that the ADC helps you deliver the payload directly to the tumor cell. So you get specific to killing of that tumor cell, and you have reduction of the systemic toxicities that are commonly associated with small molecule inhibitors. In addition, the ADC improves the pharmacokinetic properties of the payload, as you can see here. As with the small molecule inhibitor, what you want to do overall, regardless of whether it's a small molecule inhibitor or an ADC, you want to maximize the duration of response at the site of the tumor. One way in which you could do this is by maximizing your AUC or your exposures for the small molecule inhibitor or the ADC. You want to remain above the subtherapeutic exposures because you want to stay in this green zone, which is where you're having your best effect. What you want to do also is stay out of this red zone as much as possible. This is where you're going to have your adverse effect exposures. This is where you have your toxicities associated with your molecule. You want to minimize this as much as possible. So that's why the ADC in particular does both jobs. It minimizes the adverse exposures. It maximizes the time above the subtherapeutic exposure, giving your ADC the best time to carry out its function, which is to kill tumor cells. Now, within the ADCs themselves, what we want to do is maximize the therapeutic window, not just between the small molecule inhibitor and ADC, but also between ADCs as well. And maybe there'll be some questions in the audience related to the maximizing the therapeutic window. So in I show this slide because I want to talk about, what the current state of the art is for linkers as it relates to, and also linker catabolism as it relates to ADCs that are already approved. So all these ADCs have already been shown to be efficacious and to be safe. And that's why there's 13 have been approved globally, 11 have been approved by the FDA. As you can see, looking at the highlighted linker portion, that there's a variety of different types of linker options available. There's the MC, which is your maleimide linker, and this is a non-cleavable linker, just conjugated to a cysteine. You also have your dipeptide linkers shown here, your val-cit linkers, for example. Those are also conjugated to cysteines, and they're all cleavable linkers. They're protease cleavable linkers, as I mentioned before previously. In addition to the dipeptide linkers, you also have the 4-peptide linkers shown here, which is the linker that's primarily used for HER2. We've heard a lot about HER2 and the success that it's experienced in the clinic right now. We know this is a cleavable linker conjugated to cysteines as well, using a topoisomerase inhibitor. What I'm going to do is to first start off talking about Mylotarg. Mylotarg was the very first ADC that was approved. It was approved for treating AML cancer patients who are a little bit on the older side, 60 plus. So with Mylotarg, you can see the design is utilizing a hydrazone linker, which is a pH labile linker. And that only occurs once the ADC reaches the lysosomal compartment, and therefore begins to initiate the process of releasing the payload from the linker. After hydrolysis, the glutathione comes into play, and glutathione will cleave this disulfide bond here, thus resulting in the actual release of the fully functional calicheamycin payload. A couple of other things I want to point out for this ADC in particular is that it's an average DAR between 2 and 3, so the average of 2 or 3 drugs per antibody. And this 50% of the antibody is unconjugated. So this is unusual because of the simple fact that 50% of your antibodies is unconjugated. That means 50% of your antibody is going to be working against your ADC. And we also notice here there are no spacer and there's no pegs. So conjugation conditions using this type of technology really are going to play an important role of maximizing the effectiveness or the CMC properties of your ADC. That brings me to the next slide, where I'm talking more about one of the members of the auristatin class, which is MMAE. As you can see, this linker design is different from the first one, whereby you have this maleimide conjugation moiety that conjugates the cysteines. You have now this dipeptide linker, the val-cit linker, and you also have this PAB-C spacer. This PAB-C spacer is there because it gives the cathepsin B, the protease cleavable enzyme, the ability to come into this space, cleave the dipeptide linker, thus resulting in the release of this active molecule, which is MMAE. MMAE is very high membrane permeability. So as I mentioned before, this is one of these molecules where you're able to get bystander activity. Now, some of the other features that we see routinely now using this and other types of conjugations is that we have between 75 to 90% conjugation efficiency. Remember, Mylotarg was only 50%, so we've improved that substantially. There is between 90-95% greater monomeric content, so you've reduced the aggregation issues associated with some of the other conjugations. For these types of ADCs, the traditional ADC for using stochastic conjugation is DAR 4, so 4 drugs per antibody. If you try to go above DAR 4 using this type of linker payload, you're going to run into aggregation issues. And I know Matt has in his presentation some technology using very, very interesting linker chemistry, which can get you around this potential issue, so you can develop ADCs with a higher than DAR 4 for MMAE. With that being said, there is the other member of the family, and that is the MMAF. This is also an auristatin. It's monomethyl auristatin F. It's using the MC of the maleimide linker conjugate to cysteine. As you notice that there's no dipeptide and there's no PAB spacer associated with this one. And what happens is that the way this payload is actually released, this is the active payload here, this cis-MC-MMAF. So this needs antibody degradation in the lysosomal compartment, which leaves you just with the cysteine conjugated to the MC, the maleimide linker, and the active moiety, which is MMAF. This molecule has low membrane permeability, which means once it gets inside the tumor cell, it stays inside the tumor cell. So you're not going to get bystander activity with this type of linker payload system. Moving forward, looking at as the ADCs develop, the chemistry associated with developing the ADCs in a linker becomes a little bit more intricate. And I'm showing you here, this is an ADC for against TROP2 using the SN38 topoisomerase inhibitor payload. The linker here is CO2A, but you notice here is that you begin to see the incorporation of PEG solubilizing groups because of the hydrophobic nature of the payload. And this, you have to add this because you want to increase your solubility. So in some cases, you might be able to make chemical modifications of the payload to address some of the hydrophobic nature, some of the hydrophobicity issues associated with the payload. Sometimes you're not. In cases where you're not able to do that because you'll decrease the potency of the payload, now you have to really focus on the chemistries of your linker, which is why they added this PEG7 group here to improve the solubility for your conjugation. And the last slide I'm going to show with regards to talking about these different types of linkers is this one, where this is a CD19 ADC, it's an IgG1. And you see in this case, you have DPEG8 as part of the linker component. Why? Because it improves solubility, reduces aggregation. The second part is that there's a val-ala linker instead of a val-cit linker. As you can see, the val-ala linker has lower hydrophobicity than the val-cit linker, so that helps with regards to improving the solubility of your linker payload. There's also the PAP spacer as well. As I mentioned before, this type of payload, the PBDs, are known to be very hydrophobic payloads. With that being said, we know that you can also get bystander activity with this type of a payload that we could not get with the MMAF payload. As I mentioned before, when I talked about the therapeutic index slide, I specifically talked about exposure as opposed to dose, because it's the exposure, the pharmacokinetic properties, that's going to drive your efficacy. And it's also going to play an important role with regards to your toxicology findings as well. So we know that with naked antibodies or unconjugated antibodies, they have a really good normal IgG profile in terms of pharmacokinetics. But with the ADC themselves, you begin to see a loss of the ADC over time. You get this deconjugation of the payload away from the ADC. So you have more instability with this type of conjugation methodology. As you increase the stability of the linker, you increase the stability of the ADC, thus giving you more pharmacokinetic properties that are more in line with what you see with the total antibody. And you see less deconjugation. This is going to be important, as I mentioned before. What you want to do is to have more time on target. So the more time you can get the ADC onto the tumor, get more drug release into the tumor, the better efficacy you're going to get. But that being said, if you look at stochastic conjugation methodology shown here at the bottom, you can see is that as you increase the DAR, the number of drugs per antibody, you also increase the clearance rate. So this is why it's really going to be important to find the optimal DAR for your ADC. So you want the best of both worlds. You want to make sure you have enough stability to get the ADC, the drug, to the tumor, and you also don't want to have the liability of having increased toxicology by having premature release of the payload. So this improved stability leads to an improved therapeutic index. So what's next coming for ADCs? I've talked about what we already know about ADCs and the linkers, but what's coming next? And really it falls into two categories. One is a site-specific conjugation, and the other is using branch linkers to accommodate dual payloads. For site-specific conjugation, I'm going to show some specific examples using primarily Ajinomoto's lysine site-specific conjugation technology, because I think this is interesting. There's about 92 lysines that are available for conjugation using the stochastic method. And most of the time for site-specific, we're using cysteine. So this is a little bit different take on the site-specific conjugation. We also have non-natural amino acids. I mentioned Ambrex is the leader for this technology. We also have some exciting conjugation technologies coming to the forefront from Synaffix and AlphaMab, because they're using what is called glycoconjugation. So using the carbohydrates on the antibody themselves as points of contact or conjugation for the linker payload. The advantages of Ajinomoto's and Synaffix and AlphaMab's technology is that it doesn't require antibody engineering. So you can just take an antibody off the shelf that you're using and use these type of technology, as opposed to using something like Ambrex's technology. That's going to require antibody engineering, and that you have to find the right site to actually incorporate your non-natural amino acid to get the stability and the efficacy you're looking for. With regards to branch linkers and dual payloads, some of the advantages, potential advantages are, one is you can combat against drug resistance mechanisms. And the other one is that you might be able to find the right combination of the two payloads to give you synergistic inhibition of tumor growth. This is something I think we're all looking forward to see how this plays out in the clinic. In this slide, we're just looking at the overall schematics of these different types of technologies, and I'm going to highlight a few key points. One is with the Ajinomoto's technology. The site matters where you conjugate. So if you look at lysine 248 versus lysine 288, your overall yields are going to be much higher with using lysine 248 as opposed to using lysine 288. So not only does the linker payload matter, but also the sites where you conjugate matters as well in terms of your yields. With regards to AlphaMab, their technology, they are using a one enzyme technology relative to a two enzyme methodology that you see for Synafix. Both are using modifications of carbohydrates to elicit their site-specific conjugation technology. And the last one, as I mentioned before, this is Ambrx's technology. We're using the incorporation of non-natural amino acids using a stable oxime bond. And also, they're also using the MMAF payload, as I mentioned before, doesn't really have bystander activity. So you have several options available to you with regards to looking at site-specific conjugations. With that being said, so what's the advantage? So the advantage of site-specific conjugations is that the site-specific conjugations can improve your pharmacokinetic properties. And hopefully with that being said, they can also, it gives you a better therapeutic index compared to your traditional stochastic conjugations. On the panel A, this is the example I showed before of what your ADC looks like using traditional stochastic conjugation methodologies. In panel B is the example of what it looks like using site-specific, where you have reduced deconjugation of your ADC. What Ajinomoto has shown as well is that the stochastic conjugation methodology results in this, and also results in decreased stability of your ADC, while the site-specific version of their ADC results in almost identical pharmacokinetic properties to the naked antibody. Second thing is the DAR, the number of drugs per antibody. With the site-specific, you have a DAR of 1.6. With the stochastic, you have a DAR of 4. So essentially for half the DAR, you get better pharmacokinetic properties. But how does this translate into efficacy and also toxicity? Well, they performed an in vitro efficacy study in the NCI N87 tumor model. And in this tumor model, you can see that the site-specific ADC performs just as good as the stochastic ADC with the DAR 4. So that tells you that although you have less drug per antibody, the activity is still similar to what you get with the stochastic conjugation methodology. There are other examples not shown here where you can see that the site-specific ADC gives you better efficacy compared to the stochastic conjugation method. But efficacy is one side of the equation in terms of your therapeutic index. What about toxicity? In terms of toxicity, what we see is that at the 40 mg per kg, using stochastic conjugation methodology, you have a significant loss in body weight. And with the site-specific conjugation, you don't see that, right? And then, of course, looking at outside of body weight as a surrogate for toxicity, there are specific markers of toxicity you can use in your evaluation as well. One is AST. AST is a marker commonly associated with liver toxicity, and the loss of platelets is commonly associated with thrombocytopenia. What you can clearly see is with the site-specific conjugation, you can see that the level of AST are low, almost to the same levels as your buffer or your control, while the stochastic conjugation gives you high levels of AST. The same trend is also seen here for platelets, where if you take a look at the platelets, the site-specific does not result in a significant decrease in platelets, while the stochastic conjugation methodology does. So these data tells you that you can probably get better therapeutic index, at least preclinically and hopefully clinically, from using not only this type of technology, but perhaps site-specific technologies in general. So if site-specific technologies are so good, what does it look like in terms of the clinical landscape? We know that for site-specific ADCs, they're primarily in early clinical development, phase 1 all the way to phase 2. Very few are in phase 3 right now. But the ones that are in phase 3, I've highlighted here in this table. And the take-home message from this slide is that what you see is that with regards to linker and payload, they're using linkers and payloads that are commonly associated with the approved ADCs. So this is an effort to try to de-risk your ADC development. You can go with a novel approach with a novel ADC, novel technology, and novel linker payload, but that adds a significant amount of risk for your development. Going with something that's already been clinically approved or clinically active kind of helps you de-risk that moving forward. And this is what many of the companies using site-specific technologies have the approach they've taken. Now, with regards to the last part of my presentation, when we're talking about the utility of branch linkers to facilitate the incorporation of dual payloads. So with this technology, essentially what they've done is to use the MTG ACE to mediate the linker conjugation to the antibody, and they have orthogonal chemistry that they're using to incorporate MMAE and MMAF to the ADC, right? This is a one-pot reaction, and I'm pretty sure Matt's going to talk about this a little bit more in his part of the presentation. But the take-home message is that you can get more bang for the buck. You can get two linker payloads conjugated to your ADC, giving you a DAR of between 4 and 2. 2 for the MMAF, 4 for the MMAE. So the question is, what's the advantage of doing this? What they show here in their in vivo efficacy study in this HCC 1954 tumor model, what they show is that the site-specific ADCs with the dual payloads gives you better activity compared to just taking the trastuzumab ADC that has a DAR 4 and the trastuzumab ADC that has a DAR and it has an MMAF of a DAR 4 as well, and adding them together. So the addition of two ADCs with higher DAR doesn't necessitate better activity compared to the DAR that has a dual payload. That's both seen in the tumor volume and also with regards to the tumor weight. And with that being said, I think the last thing I want to make sure, the last thing I want to make sure we see, you pay attention to is that it's just really good to have an ADC toolbox available to you where you have different antibody formats, different linker payloads to choose and optimize to give you the best ADC moving forward. And with that, I'm going to thank Vector Labs for giving me the opportunity to share with you some of my thoughts on developing linkers and payloads for ADCs. Fierce Pharma for hosting this, and also Beacon by Hanson Wade for giving me access to their ADC database, which is really good for competitive intelligence. Now I'll turn this over to Matt now.
All right. Okay, thank you, Dr. Jackson, for that synopsis of some of the important features of ADC design and performance. Trust everybody else on the other side of the screen is having an outstanding day today. Dr. Jackson mentioned that the linker was one of the tools in the toolbox of ADC design. And so for this last section, I'd like to give some examples from the literature where scientists and researchers have used linker payload design, specifically the incorporation of PEG component, to improve ADC performance. Biodesign leverages results such as these to provide linkers that you can use for optimizing your ADC design. So I'll finish up with some examples of some of those products that we sell. Okay, so first we'll get into how incorporating a PEG into the linker payload can help you build the ADC and improve physicochemical properties such as hydrophobicity and aggregation. So Dr. Jackson had shown us the structure of Xylanta and had mentioned that the PEG-8 spacer was important to reduce aggregation and improve solubility for the PBD ADC. And these are some more examples of that by Spirogen, Seagen, and AstraZeneca. And what we have here is payloads on the left, linker payloads in the middle, ADCs over on the right. In the top, we have a DAR2 ADC without a PEG spacer. And that that payload C-log P is 2.91. That's a measure of hydrophobicity. In the middle, they have put the Val-Ala cleavable trigger on and the malleamide reactive group. That resulted in an increase in the C-log P of that payload. That linker payload is called talarine. Conjugation of talarine to an antibody gives us a DAR2 ADC with 13% aggregate and 51% yield. In the example in the middle, now a PEG-8 spacer has been incorporated into the linker payload design. The payload is shown over there on the left. It has a C-log P of 2.98. The structure has been manipulated a little bit compared to the above example, but hydrophobicity has not changed much. In the over to the right, they have put the Val-Ala trigger, the PEG-8 spacer, and the malleamide reactive group on. This linker payload is known as tesirine, and it has a lower C-log P. Conjugation of tesirine to an antibody gives us a DAR 2.5 ADC with only 3% aggregation and 86% yield. So what we can see here is that incorporating that PEG spacer resulted in an improvement in aggregation profile and an improvement in conjugation efficiency. Now, I will note the above example, they conjugated talarine to an antibody, an engineered antibody at cysteine 239, and that proceeded in 96% yield and only 2% aggregate. So there are other ways to achieve this goal. As Dr. Jackson mentioned, conjugation site matters, and that's the case there. But that example in the middle shows that incorporating a PEG spacer can also help you achieve this goal. And that can be important if you don't have access to antibody engineering, or if you just can't find a site that helps you achieve the desired goal. The example on the bottom shows that you can also apply this approach to higher DAR ADCs. The payload is shown over there on the left. Its structure has been manipulated further to reduce the hydrophobicity even more. It did reduce the potency of that payload, which is now why you're having to compensate that with a higher DAR ADC. Putting the Val-Ala trigger, PEG-8 spacer, and malleamide reactive group on that payload reduces the C-log P even further, and conjugation of that linker payload to an antibody gives us a DAR 7.7 ADC with only 5% aggregate and 99% yield. So these examples show that the combination of that PEG spacer, the cleavable trigger, and the payload can impact ADC conjugation efficiency and yield. These examples here show that you can also apply this strategy to other payloads. This was some work done by Millipore Sigma, and they're using the topo-1 inhibitor, SN38. Topo-1 inhibitors are all the rage right now, and there's several examples of DAR8 ADCs with topo-1 inhibitors that don't need a PEG to improve their properties. Enhertu is the best known example. AstraZeneca has reported some in the literature. Zymeworks has reported some in the literature. So it's not always needed, but Dr. Jackson did show us the structure of Trodelvy, and Trodelvy has an SN38 payload, and they did need a PEG-8 spacer to improve its properties. And these are some examples that also need that help. The top example shows a DAR4 and a DAR8 Val-Cit SN38 ADCs with a standard linker. Over on the right, we can see the C-log P of that linker payload is 3.81. This results in a DAR4 ADC that's 20% aggregate and a DAR8 ADC that's nearly completely aggregated. In the example on the bottom, we have some DAR4 and DAR8 Val-Cit SN38 ADCs. Now they've incorporated the hydrophobic DVCO moiety to use click chemistry. Very hydrophobic reactive group, but they've offset that by putting a PEG-12 spacer in between there. Over on the right, we see that they did indeed reduce the C-log P of that linker payload, and this provides a DAR4 ADC with only 8% aggregate and a DAR8 ADC that's only 15% aggregate. That's a significant improvement from the example on the top. So these examples show that PEG spacers can reduce linker payload hydrophobicity and ADC aggregation if you have a problematic combination of cleavable trigger and payload. These examples here show a similar thing with the popular MC Val-Cit MMAE linker payload. This is also known as vedotin. Dr. Jackson showed us some examples of this and mentioned it's problematic above a DAR4, and these examples kind of support that. The example on the top, it's the MC Val-Cit MMAE linker payload. They've incorporated the hydrophobic DBCO reactive group, tried to offset the hydrophobicity with the PEG-12 spacer, but over on the right, you can see that this wasn't really enough to do the trick, and it's still 72% aggregated. So the example on the middle there, what they've done is replace the PEG-12 spacer with a PEG-24 spacer. And over on the right, we see that that did indeed reduce the hydrophobicity of the linker payload. And now this DAR8 ADC is only 9% aggregated. There's more to aggregation than hydrophobicity. It's a simple calculation to do, so we use that. But some chemical moieties are just more prone for self-association. Insulin lispro is a great example of that. So this example in the bottom kind of shows that. It's that exact same combination of DBCO reactive group, MC, Valcit, MMAE. But now what they've done is they've taken the PEG spacer and put it in an orthogonal position rather than between the payload and the antibody. So what this has done is it kind of shields that trigger and payload. And in this case, it's only a PEG-8 rather than a PEG-24 and PEG-12 like the examples above. And you can see that's reflected in the C log P over on the right, which is actually higher than the above two examples. But the DAR8 ADC is only 7% aggregated, which is lower than the above two examples. They further went on to show that you can put a PEG-12 and a PEG-24 on the side, and it reduces your aggregation even further. But this just goes to show that PEG spacer length and the positioning of that PEG can also influence linker payload hydrophobicity and ADC aggregation, and those two aren't necessarily correlated. And if you have a really problematic combination of reactive group, cleavable trigger, and payload, you might have to optimize both of those variables. Dr. Jackson mentioned the use of branch linkers to accommodate multiple payloads if you're looking at developing ADC with a dual mechanism of action. This example, like his, uses both MMAF and MMAE, so you have an ADC with mixed bystander activity. But what CGen did here is they put a PEG-24 spacer in that orthogonal position, and they capped it off with a carboxylic acid group. So this improves the hydrophilicity and water solubility of that linker payload. Putting MMAF and MMAE on there then results in a DAR16 ADC with mixed bystander activity, and it's 98% monomer. And that's a pretty impressive feat for a DAR16 ADC. These branch linkers can also be important for increasing the DAR when you have limited sites available for conjugation. And you can encounter this when you're using certain engineered antibodies or you're using certain site-specific conjugation technologies. You just don't have the number of reactive groups there. So here's an example where they took a multifunctional linker and installed it at Q95 via microbial transglutaminase. So even though you still only have 2 conjugation sites on that antibody, the branched linker allowed you to put 4 reactive groups on that antibody. And now you can come at it with this single payload linker, do your bioorthogonal click chemistry, and you end up with a DAR4 ADC with 2 payloads per conjugation site and less than 1% aggregate. So in this case, the linker design allowed them to increase the DAR on an antibody with limited conjugation sites by increasing the number of reactive groups per conjugation site. This is an alternative approach. This is Lego Chem Bio that did this. Here what they did is they took a linker and installed it at an engineered tag at the C terminus of the antibody via farnesyl transferase. So now, even though there's still only 2 reactive groups per antibody, they're reactive and bioorthogonal carbonyl groups. Now you can use this multi-payload linker with the oxime chemistry and do your bioorthogonal oxime ligation. And again, you can end up with a DAR4 ADC with 2 payloads per conjugation site and no mention of issues with aggregation. So in this case, a branch linker design enabled them to increase the DAR of an antibody with limited conjugation sites by the use of these multi-payload linkers. So that was some examples of how you can incorporate a PEG spacer into your linker payload design to help you build the ADCs and improve their physicochemical properties. For the next 2 sections, we'll look at some in vivo properties, and I will just focus on PK and tox. Dr. Jackson had a nice slide showing the effect of conjugating a payload to an antibody on the clearance. Generally, when you conjugate an antibody with a payload, the clearance of the ADC is increased relative to the naked antibody. And this is correlated with DAR. The higher the DAR, the faster the clearance. And this was established by the OGs, Seagen and Immunogen back in the day with auristatin payloads and maytansinoid payloads. Here I've got some examples with some PEG-8 spacers and PBD payloads showing how you can try to mitigate that effect. The examples on the top are DAR2 ADCs. The one on the left is a Val-Ala PBD ADC without a PEG spacer. And that DAR2 ADC has a half-life of 2.4 days. The example on the right is a Val-Ala PBD ADC, and now a PEG-8 spacer has been incorporated into that design. And that DAR2 ADC has a half-life of 7.2 days. So this is an example where that linker payload design, changing it up, resulted in a threefold increase in the half-life of the antibody. Now, I know there are some caveats with this head-to-head comparison. The antibodies are different, and that can matter. We don't know the half-lives of the naked antibodies, so you can't really look at the direct comparison there. But I think we can probably agree that a half-life of 2.4 days is a lot less than we'd like to see for an ADC, whereas a half-life of 7.2 days is more in that acceptable range. I'm also not claiming that this fixes everything. This exact same payload over on the right was in Rova-T, which failed in clinical trials. It was in ADC T301, which failed in clinical trials. So we're just looking at half-lives here, and if that's a concern, this is a way to address it. The example on the bottom shows the effect of an increasing DAR on ADC's half-life. And here we have some DAR 2, 4, and 8 Val-Ala PBD ADCs, again with that PEG spacer in there. In this case, we do know the half-life of the unconjugated antibody is 13.4 days. And then beneath that, I show the half-lives of the DAR 2, DAR 4, and DAR 8 ADCs. And what we see is that even though there is a decrease relative to the naked antibody, it's not completely surprising, we can see that there is no dependence on DAR. The ADCs have the same half-lives for DAR 2, 4, and 8. So this is an example where PEG spacers can help you improve the half-lives of your ADCs. Again, at least for PBD payloads, and this is an important caveat, a lot of people have had success with linear PEG spacers and their payloads, but Seagen did some nice work showing that this is not a universal solution. They had some ADCs with the glucuronide trigger and the MMAE payload, DAR8 ADCs, and when they put a PEG-24 spacer in there, they found that ADC was actually cleared faster and was less efficacious than the ADC without any PEG at all. So it actually had the opposite effect. What they also showed in that seminal work is that if they took the PEG and put it orthogonal to the payload and antibody rather than between the two, that resultant DAR8 ADC was cleared slower and was more efficacious than the other two ADCs. So I'm not going to cover that initial result, but this is a follow-up study that they did where they looked more closely at the effect of that orthogonal PEG spacer on the PK of the ADC. So the structure of the ADC is shown there in the middle, and they vary the number of ethylene oxide units in that side chain. The rat PK is shown over there on the right. And what we can see is that for the ADCs with the PEG-8, the PEG-12, and the PEG-24 modifiers, the pharmacokinetics and the exposure are real similar to the naked antibody. So that's a pretty neat finding. I also put the HIC retention times below that. This is from a different study that they did, but I just thought it was good to see this comparison. We like measuring the HIC retention times of ADCs to gauge their hydrophobicity, and then we use that to infer PK liabilities downstream. Later retention times means more hydrophobic, means cleared faster. But here we can see that's clearly not the case. The unconjugated parent antibody has a retention time of 3.7 minutes. And those three ADCs, those DAR8 ADCs with the PEG-8, 12, 24 spacers have retention times that are nearly 3 times as great. So we would think more hydrophobic, cleared faster, but based on the PK studies above, we see that that's clearly not the case. Exposures are about the same. And a number of other groups have noticed this now as well. So just use caution when you're trying to use HIC results to extrapolate to PK liabilities. It's not always a correlation. So finally, I'd like to get to the great slayer of ADCs in the clinic, tox. This is by far the #1 reason that most ADCs fail in the clinic, as off-target tox or failure to show efficacy at the maximum tolerated dose. And I'd just like to show some examples of how this can be reduced with PEGs in the linker payload design. So again, this is another example by the Mighty CGen. They're looking at the effect of that orthogonal PEG modifier on the tolerability as assessed by loss of body weight. They're varying the number of ethylene oxide units in that side chain. The chart over on the right shows the percent body weight change. And what we can see is that these DAR8 ADCs, their tolerability when dosed at 17 times the efficacious dose is similar to vehicle for the PEG-8, the PEG-12, and the PEG-24 modifiers. So that's a pretty neat finding. I don't present any of the results here, but they did some follow-up studies that are worth looking into. They also show that increasing that PEG length is correlated with a reduction in off-target uptake by liver, spleen, and bone marrow. And they also show that it's correlated with improved clinical pathology profiles. So this is an example where these PEG modifiers can be used to improve tolerability, probably by reducing off-target uptake. And these two examples just show this same strategy can be applied for different combinations of cleavable triggers and payloads. In that top example, it's a DAR8 ADC, has the same MMAE payload as in the previous example, but now the cleavable trigger is changed out to val-ice. And in this case, there's only a 5% decline in the body weight of mice dosed at 20 times the efficacious dose. In the example on the bottom, it's another DAR8 ADC. The cleavable trigger is still val-ice, but now they've changed out the payload to paclitaxel. And in this case, that DAR8 ADC only showed, well, essentially no change in body weight for mice dosed at 10 times the efficacious dose. So these examples show that incorporation of PEG spacers and modifiers can improve the tolerability of these high DAR ADCs for a variety of different combinations of cleavable triggers and payloads. So in conclusion, as you can see, choosing a linker for your conjugate is easy in theory, but it's difficult in practice. What's good for the goose is not always good for the gander. And biodesign from Vector Laboratories can help deliver your therapeutics potential by harnessing proprietary linker architectures, incorporating chemical biology expertise, and leveraging 20 plus years of linker design to provide a toolbox of linkers that you can use for optimizing your ADC's performance. So I just want to open up that toolbox a little bit so you can see what we have. First, we have different linker architectures. We have linear, branched, and sidewinders. They can accommodate different numbers and different types of payloads, and they can control the orientation of those components on the linker payload, like that orthogonal linear designation. Second, we have different reactive groups for conjugating your payload and your cleavable trigger. If you have your own proprietary cleavable trigger, you're probably going to want a carboxylic acid or an active ester. If you're using the standard dipeptide cleavables, those can be provided as the val-cit and val-ala PMP carbonates. We have other groups available for attaching payloads, but right now most common payloads in the clinic are attached via amines and active esters. So I've just restricted it to that for this webinar. Third, we have a number of reactive groups for conjugation to the antibody. To keep it simple, most of the examples that I've put in this webinar are conjugation to hinge cysteines. So we have a number of options available for conjugating to sulfhydryl groups and hinge cysteines. As Dr. Jackson mentioned, there's a lot of site-specific and bioorthogonal conjugation technologies that are garnering interest. We do have those groups as well, the DBCOs, the TCOs, the tetrazines, the aminoxys. So those options are available as well. We also have different end capping for different property modification. These include methoxy, hydroxy, and carboxylic acids. They can help change the polarity and or charge in physiological environments. The only example in this slide deck was CGen's DAR16 that had the carboxylic acid group at the end, but Mersana's Synthomer scaffold is also making use of features such as this. And this is an example of more sophisticated custom structures that we can provide for you with our biodesign service. We can work with you to really help fine-tune the physicochemical properties of your ADC, optimize the DAR. We can control steric congestion around that trigger and payload to predict metabolic liabilities or modulate payload release rates. The structure on the left we refer to as the body armor architecture. We had a bioconjugate chemistry paper in 2022 that details some of that. The structure on the right would be analogous to Mersana's synthomer scaffold, and I would recommend that you go and look at some of their work with that. It's pretty interesting. And then these would finally be some examples of kits that we can provide through the biodesign service. In this case, there are 3 component kits that could facilitate the construction of dual MOA ADCs. Step 1, you activate your first payload. Step 2, you activate your second payload. Step 3, you put them on the carrier. Step 4, you conjugate them to the antibody. So this would really help overcome resource constraints, especially if you're chemistry limited. Let us handle some of the chemistry. And it can also maximize your development diversity by allowing you rapid access to different combinations of payloads and linker variables. So in summary, linkers play a critical role in multiple aspects of an ADC's performance, from how you build them to their physicochemical properties to their in vivo performance. It's therapeutic window, right? You want to get more of this ADC where you want and keep it away from places that you don't. ADC performance can be optimized with the right linker design, and biodesign from Vector Laboratories is a collaborative developmental process to help you achieve this goal. I'd like to conclude with a quote from the father of modern medicine. Medicine is a science of uncertainty and an art of probability. And drug development is certainly no different, and antibody drug conjugates are certainly no exception. The road to developing a successful ADC is filled with uncertainty and challenges, and it's definitely littered with failed attempts. It is exciting to see all the different ways that developers are trying to overcome these challenges, from new payloads that work with old mechanisms of action to new payloads with new mechanisms of action, to different cleavable triggers, to different conjugation chemistries. And we'd like to throw linker design into that bag of tricks for ADC developers to use. And that concludes this part. I'd like to thank all our webinar registrants for tuning in. Hopefully it was informative, and let's keep making some medicines, yeah? And with that, we'll open up for some questions.
Fantastic. As we dive into the Q&A, quick reminder to the audience, you still have time to submit your questions. Just use the Q&A tab on the left side of your screen. We'll cover as many as we can, and the team will reach out and answer your questions offline if we don't get to them, so do submit your questions. Our first question says, would you consider rebridging conjugation, site-specific conjugation?
Yes, I'll take that question. I think the short answer is yes. And the reason why I answered yes to that question is because site-specific conjugation methodologies cover 2 different points. One is that you want a homogeneous DAR, and thiobridge technology gives you that. The second one is related to the stability of the ADC. So the stability and pharmacokinetic properties using thiobridge accomplishes that as well. So I think the short answer is yes, it does.
Fantastic.
Yeah, I can add to that a little bit too.
Yeah.
Conjugating to hinge disulfides, you're still conjugating that same region, but you're doing it in a defined ratio now, and you are saturating that whole area, so you're getting a defined DAR that is stable. So I would agree. And the other thing, a lot of those next generation malleimides, the thiobridges, the dibromomalleimides, the dibromopyridazine diones, they are kind of hydrophobic, and a lot of them do see some benefits from incorporating a little deep egg spacer in there to help out with the yields and the properties of the linker.
Right.
How does branched linker affect the PK/PD of ADC?
Yeah, that's another good question. I think the answer is complicated, but I think in short, with the limited number of examples we do have, it shows that the branch linkers in of themselves provides the similar type of stability as the unconjugated antibody. So you have good pharmacokinetic properties. But I think that's really dependent upon multiple factors that we talked about today. It's going to be dependent upon what type of linker you're going to use, what type of payloads you're going to use, and incorporate it into that whole structure. With regards to pharmacodynamic properties, we don't know. The answer is still, the jury's still out for that. But I think the dual payloads also gives you more complexity. for your pharmacokinetic assays. So now you have two different payloads you have to monitor as opposed to one specific payload that you have to use before. So moving forward, your assays you develop are going to be more complicated.
Is there, I may not be pronouncing this right, is there a C-log-P range ideal for linker payload?
Yeah, I'll take this one. This is kind of a chemistry thing. You could look at Lipinski's rule of 5 for ideal C-log-P for orally bioavailable drugs, which I think is somewhere between maybe 2 and 5, 3 and 5, certainly less than 5. But I would say the short answer is no. We did have a slide in there showing that you can still have a linker payload with a high C-log-P that does not aggregate if you have the DPEG positioned correctly. You have to remember that you can only do so much to your payload's hydrophobicity before it's not going to get across cell membranes. It's not going to reach its target. It won't undergo endosomal escape. So you do need to maintain a certain level of hydrophobicity. So yeah, it's tough to say there's an ideal C-log-P. And again, maybe Lipinski's rule of 5s it's the best guide, but you can only go so far, and then you're going to have to try to compensate with other things on that antibody or the PEG.
What are the cases where linear or orthogonal linkers would be used?
I'll take that one again.
Thanks, Matt.
No one size fits all answer here, but I would say if you have a payload that you cannot manipulate much to get its properties into a reasonable area, then you're probably going to want to use an orthogonal type linker. Otherwise, you have this greasy payload out on the end of this long chain, like a greasy tetherball, and they're just going to want to glom onto everything. Non-specific interactions with tissues in vivo, aggregation with each other. If you have a payload where you can manipulate the payload, AstraZeneca's done a lot of nice work with this. Things you can lower the C-log-P of that payload to get it to a nice, reasonable range. Then maybe you want to use a little short linear linker just to nudge its properties into a right range. Orthogonal linker might help with properties, but you are going to affect the enzyme access to that payload. You're going to affect other things. So you kind of have to look at the package deal. So I would say if you have a payload that is super hydrophobic, even look at people are putting Protacs on now. You can't really do much with those. Those are firmly in the beyond rule of 5 category. Maybe you want to think about an orthogonal linker because you can only add so much PEG. If you can manipulate it, add. I've seen at Glycos that's some nice stuff with some glucuronide prodrugs as well. If you can get a C-log-P down that way, then maybe a linear is just fine.
Yeah.
Why is there an increase in hydrophobicity as determined by HIC when the PEG linker is used?
Dowdy, you want me to take that one?
Yeah, go for
it. So PEG has an interaction with an HIC column and with the HIC resin. And when you run hydrophobic interaction chromatography, so PEG is amphiphilic. It's not actually hydrophilic, right? The reason it's so hydrophilic is each ethylene oxide unit is strongly associated with 3 molecules of water. That's why it's hydrophilic. When you load a HIC column, you're in 1 molar, 1.5 molar sodium or ammonium sulfate. You're kind of forcing everything to shed its hydration layers. That's not really an accurate depiction of what happens in vivo. So especially with PEG, when you force it to shed its hydration layer, it interacts with the column. And that's kind of not reflected in what you see in vivo. I've seen some interesting studies that actually Agensis did this a while ago. They were looking at hydrophobicity by the ANS assay, and they could put more and more PEG on there, and they actually decreased the hydrophobicity of the ADC by that assay. So is it the assay you're using? Is it the starting point? So I just don't think that maybe HIC chromatography is the best way to look at the hydrophobicity of that ADC if you're wondering how it can behave in vivo. PEG is just going to stick to that column in that situation. But when you throw it in vivo, I don't think you're going to see those problems.
No, you won't.
Yeah.
Well, fantastic. We're actually coming to the end of our time, but we've had so many really great questions. And since we couldn't get to all of them, the team will be doing their best to get back to everyone who submitted personally after the webinar. This webinar has been recorded, so you can access the recording within 24 hours just using the same link sent to you earlier. There is an exit survey, so if you would, please stay logged on just for a quick minute to complete a brief survey. Thank you so much for joining this Fierce Pharma webinar today. We look forward to seeing you at future events.